Hello my friends over the world. Hopefully we are giving a tough fight to this pandemic corona, and the only weapon that we have at this point of time to fight against this war pandemic is the mask. Thanks for the overwhelming response to my last video that I made on the different varieties of mask. A lot of queries came in to tell how to use this mask and what are the best masks that I would advise rather. So starting initially, this is the surgical mask that is available at every nook and corner, and this is the way that we put on the surgical mask. Now the problem with the surgical mask, if I tell you, is that it doesn't provide a very clear seal at the level of the nasal bridge, neither does it provide a clear seal at the level of the chin. So this is pretty good. It has got a 70 to 80% efficacy to save you from this pandemic, definitely. But as I rewind the history, the surgical masks were initially made to save the people from the surgeon's respiratory secretions, from the surgeon's oral secretions, so that they do not contaminate any cavities. Now coming to N95 masks that are available predominantly all over the market at every store, we have different types of N95 masks. I would recommend a proper specified NIOSH certified N95 mask. NIOSH certified. There is a National Institute of Occupational Safety and Health. So you can use this, or you can use either any of the NIOSH certified N95 masks. Now this type of masks which are available in the stores, I would rather recommend not to buy this air loops N95 mask. The reason being, they do not provide you adequate seal at the level of the nasal bridge, neither at the level of the chin. So coming to the back bands one, you can have any one. You can buy from any company. I would not like to promote or demote any company specific per se. So you can have any of them. I am choosing this for the description. Now coming to the way of putting on the mask, it's very, very important. How do we put on the mask? That all determines the quality of the seal that we had. The CDC recommends a lot of qualitative and quantitative guidelines how to check the mask, but that is not possible on the grassroots level or at a home level. So what do you do is, take the mask, start it from the chin, put it here. Just put it like this. Now once you have put on the mask, you don't have to use a single hand. God has given you two hands for a purpose, and probably this was the purpose. You have to use two hands on your nasal chin so as to press the metallic nasal bridge so that it creates a proper seal on your nasal bridge. Done. Your mask is on seal. How do we test it? You just take a deep breath and exhale. If you feel any air at this point of time, at this point, that means your mask seal is not proper. You have to do maneuvers to make a proper seal of the mask. Now what maneuvers? What you can do is, you can take the lower bridge up, the upper one down. You see this figure of X on my chins, rather on my, at this point. So you have to make a figure of X on your cheeks. So if the figure of X comes, that gives you a better seal of the N95 mask. So you have to press here and you have to press here. Just see if it is sitting properly on your chin or not. Now take a deep breath, exhale. Take a deep breath, exhale. I do not see any leak here at this point of time. Probably my mask is fitting properly and I am more than 98.8% safe with the use of this mask against this COVID virus. So that's the way how we check for the seal of the mask, and I recommend people to use the proper N95 masks which are NIOSH certified, so that you can save yourself, your family from this deadly virus. Thank you very much.